She refused Big Pharma's broken rules and changed how we fight diseases forever.
The world saw there as being two opposing models for alienating suffering and disease through pharmaceuticals. The first model, the Big Pharma model, involved spending billions to fund cures for diseases. But those diseases had to be suffered by people who could afford to pay, or the pharma company just couldn't afford to make those big investments. This model left behind the diseases afflicting mainly poor people. The other model was the public health model, pressured the big pharma companies to give their drugs away for free or at marginal cost to sufferers in developing countries who couldn't afford to pay. It worked as well, but didn't provide an avenue for drugs that didn't exist. Those aimed, again, at diseases primarily suffered by the poor. Those were the available models, and choosing between those available models meant accepting a very unpleasant trade-off where people would continue to suffer and die. Victoria Hale, as I think we all know, didn't choose. She said, no, there's a better model, a model inspired by the very best of big pharma and public health models. She needed to combine the research expertise of the big pharma model with the collaborative field-based capabilities of the public health organizations into one combined model. That was the creation of the Institute for One World Health, the world's first nonprofit pharmaceutical company. Victoria herself, in talking to me, called it the combination of oil and water, but that is what made it wonderful. And it has been particularly gratifying for the sufferers of the pernicious killer of the poorest of the poor, black fever, who have now a low-cost cure thanks to the Institute for One World Health and a new-to-the-world model.